feel so alone and so isolated, and that life can never go on, and life will never be the same. Because when somebody's taken from you so soon and so suddenly at such a young age, Tommy was only 26, you kind of lose your faith.
Between 2013 and 2016, the number of opioid-related deaths tripled. It was, I think, the second hardest hit state in the nation.
The opioid crisis is real. Granted, it affects a small number of people directly, but the impacts are much bigger. You even just think of the impact on employment and employers and workforce, and how present people are in their jobs. And you have workers who are caring for grandchildren because the parents maybe either have died from an overdose or could be in jail.
When you get into the northern parts of New Hampshire, north of Concord, let's say, and even further north, we're used to working with somewhat of limited access to, whether it be funding or other opportunities. And we have learned over any number of years that we're always stronger together. Some federal monies have come into the state to address the opioid epidemic, and the agencies can apply for these types of opportunities individually. But we decided we might be able to have a greater impact by collaborating across 4 agencies in this case.
So the IDN stands for the Integrated Delivery Network. It's part of a waiver program from the state, a Medicaid waiver program. There's 7 regions. We're part of Region 7, which is Carroll County and part of Grafton County. The real goals of the Medicaid waiver program and the IDN are really integrating physical and behavioral health, increasing capacity, and also reducing gaps during transitions. And it's looking at alternative payment models. It's all about collaboration and innovation. This particular one, 4 of us got together. It was Memorial Hospital, it's Saco River Medical Group, it's Children Unlimited, and visiting nurses for their crossing program. It's one thing to be able to provide treatment, but then how do we help sustain the positive behavior changes that people make as they go on, and we really want to sustain those and give them the support to do it.
The collaboration has allowed us to develop more resources. We have increased our capacity for screening, which means when you go to your doctor's office, you may notice that you have to fill out forms that ask lots of questions that you feel may not apply to you, but what they do is they help us notice somebody who's struggling in multiple areas, whether that's depression, dabbling in substance use, and allows us to then catch them early and refer them on to appropriate resources to hopefully help prevent the progression of those problems. It also has allowed us to maintain and expand our medically assisted treatment program, which is a program where physicians use medication to help treat opioid dependence. Thirdly, what it's allowed us to do is put in place a care coordinator, which is a specially trained nurse that is able to help direct patients to appropriate resources, patients that we've identified as at risk. It's then a person that will essentially hold their hand through the process of making sure they're enrolled to see a specialist, whether that's a therapist, or get into our medically assisted treatment program, and make sure the whole loop is closed.
This is not a separation of the body and the brain. The two function in tandem, and we have to make sure that people's mental health is taken care of in order for the body to be healthy as well. People receive Suboxone treatment here. If we identify them as needing help for depression, anxiety, or trauma, we also seamlessly can offer them services here in terms of medication or therapy. And if there are other health issues that arise, we have their primary care provider. So we can touch 3 aspects of a person's life and help to move them towards health.
So the New Life program is a grant-funded program, and it is for pregnant women and women up to a year postpartum, and we are even extending that out a little bit. It's for women that have a substance use disorder. It's not specifically for opiate addiction, although we do treat the majority of our women with opiate addiction. It provides education, it provides counseling. We have a social worker who works with us. We have medication prescribed, and it's just an overall full-rounded program to help with this sort of addiction.
At Children Unlimited, we believe that relationships are key. So our goal is to support children and families in the community to feel a sense of community and to have positive relationships. Adverse childhood experiences can be anything from a parent being incarcerated to child abuse, child neglect. There's actually studies that show that there are changes to the brain when a child is experiencing these ACEs, or adverse childhood experiences, and it actually changes brain development. And so the sooner we can get in and support the families and the children, we can hopefully make changes.
You can't help and treat part of a family, you have to treat the entire family. This grant has made it all the more for us that we can extend all of our services, which include parent education, resources, counseling, whatever people need. We have crisis intervention. We work with people at the jail who haven't even told their children where they are. So we're learning a lot about communication and relationship. They need to have help with life skills. They don't know how to find work. They don't know how to communicate. The drugs were number one, and so there's so many, it affects every aspect of their lives. The hardships were that we had so much work to do. There were so many families to serve and to provide direct service for that we often couldn't reach out to other agencies enough. This has really afforded us that kind of communication. We're much more aware of what each other provides, so we know we talk, we exchange information when allowed, so that we can wrap around these families, which is really what they need. And the IDN grant helps us do that.
Crossings is a bereavement program that was developed initially as a hospice initiative and expanded to serve the community for families who've experienced a loss, a death-related loss. We serve kids aged 3 to 18 and their adult family members. The goal being to help them connect with each other so that they're not grieving alone and to create an opportunity for peer support.
My son died of an accidental overdose. It was very sudden, and we had no idea how to cope with something so tragic and so hurtful. So we thought we would give Crossings a try as a family. It was my husband, myself, and my 2 grandchildren who I'm raising. The kids were in such shock, you know, they were 2 and 4 at the time, and they had been through a lot prior to that. So being able to be around other children who experienced similar losses, whether it be their mother, their father, a parent, a grandparent, whomever they may have been close to, just knowing in that room that they were not alone with those feelings, and that they could do something about it, whether it was role-playing, drawing, acting out different scenarios, and we would go home and talk about it. And as time grew, they grew to form relationships with the kids, which were very beneficial.
We're reacting to losses that are related to substance, so we're helping families with their grief, but we're also helping kids learn how to self-regulate, which I believe is an important component in prevention. If kids learn how to regulate their complex feelings early on in life, they learn delayed gratification, they learn how to express themselves in a healthy way, they're less at risk. So that's the hope, creating emotionally healthy people.